Good afternoon. As Rebecca said, my name is Ron McKinnon. I'm the Director of Customer Support, and I'm also the Chief Information Security Officer for Essentia Health. I wanted to start briefly about my career because it's kind of interesting. You know, a long time ago, I graduated from high school, didn't really know what I wanted to be, so I went to law enforcement school, and I became a police officer. And I did that for about a year, and I realized pretty quickly that it wasn't the field of choice for me. So then I didn't really have anything to do. I didn't have any big grand plans, so I thought, well, I'll use my education to become a security guard at a hospital. Actually, it was Fairview down in Minneapolis. And within about a 6 to 8 month period of time, the director left, and I was the next in command, oddly enough. And all of a sudden, I was thrown into this director position, management, and really had no past experience in that field. So glommed on and grabbed onto the closest mentor I could find, learned how to be a manager, and my career basically has been in management over the last 24 years in healthcare. And so I haven't been able to leave healthcare because I can tell you it is one of the most rewarding careers you will ever have an opportunity to have. And so some of you might say, well, IT, what do you have to do with patient care? And it's a common question that we struggle with many of our employees in the IT department today, in that while we're not providing direct patient care, we are delivering systems that are integral to providing patients the care that they need and deserve. So whether it's a physician who's using the electronic health record to make important decisions about care and delivery of patient care to a patient, the nurse that's trying to follow a care plan that a physician wants that patient to have. It's very, very important that all of these systems are in place so that's seamless and transparent within our organization, so we're very effective and efficient. And so we are directly related to how patients receive care, and patients are our top priority here. A couple of areas of opportunity that we really want you to think about. Our department is really broken up into a couple different areas, but most applicable to the clinical areas are clinical applications department. And so they support our electronic health record, our ancillary systems such as pharmacy, lab, radiology, things like that. And you might think that, boy, you got to have an IT degree to do that. Well, the reality is you don't. We actually really want healthcare educated people in these positions because, you know, anybody can run a computer. Okay, it might take a little bit of training, but it really requires an education and background and understanding clinical workflow. How do patients work through a system? How do care providers provide services to a patient? And once you have that general basic knowledge, we can teach you the technology side of the business. So, you know, when you're starting to think about your career and you're thinking about what you really want to do, becoming a nurse is really cool, or becoming a therapist is really cool. And that's very important to us because we really need those types of talents in our organization. But also think about how you can incorporate some type of exposure to technology in your education as well, because it'll be very important to you. Everything is electronic in our health system today. You know, you remember the old paper medical record where it used to be sitting up on the floor and the doctor or nurse would come in and have this piece of paper in front of them and pretty much tell you all about your care? Now they walk up to a computer and everything's there. And they can access your x-ray images and your lab results and what medications you're on, all from one central point of an application. So that's a very important thing.